What's up, YouTube? What's up to everybody listening? Yo, yo, yo. This is your host, Jay Nabe, rap extraordinaire. And this is the podcast, The Careers of Your Peers. And today's guest is Jimmy J, boy. You already know who it is in the building. We're talking about the career of being a pharmacist today. So tell me what you need to do to become a pharmacist. What are the requirements?
Well, you have to take 2 years of general English, math, physics, 2 years of physics, 2 years of chemistry, and pre-pharmacy curriculum, which includes organic chemistry, 1 and 2.
So would you say you have to be pretty smart to be a pharmacist?
You have to be a pretty good student.
So what do you think are some qualities a person who's interested in pharmacy would need?
Well, you need to be able to communicate with people and enjoy talking to people, and being a healthcare professional, you have to be patient with customers and people in the hospital.
So what was your experience of going through pharmacy school? Because I know you went to Temple for pharmacy, so how was that?
Well, once you get into pharmacy school, well, right now these days you have to take a pre-pharmacy pharmacy entrance exam. I think they call it a PharmCat or something like that. And then, in order to get experience in a hospital or drugstore, you need to do internship hours as a pharmacy student. So and right now it's a PharmD program, which is a 6-year program. So 2 years pre-pharmacy and 4 years of pharmacy school PharmD program.
So with the cost of college nowadays, how do you think you would afford to go to college to become a pharmacist?
Well, usually in some cases you get federal and state grants if you don't utilize your 4 years eligibility. Some people get a biology degree, then go to pharmacy school, but in my case, I was lucky. I had tuition coverage from the state and federal grants for the 3 years. I went to the Bachelor of Science in pharmacy, so I had 3 years, 5-year program altogether.
You were also making a killing flipping burgers at McDonald's, right?
Well, that was my first job, but that was before I got into college.
So what made you go into pharmacy?
Well, originally I was supposed to be a dentist, but then I didn't think that I could do well in dental school, and I went the route of occupational therapy, but I didn't like that major either, so I ended up going into pharmacy.
So when you were a pharmacist, do you have any interesting or bizarre stories?
Well, generally, I had work part time on the weekends, and sometimes patients would be extremely sick, so I'd have to give them like I worked for Rite Aid. I gave them a shopping bag so they could vomit in the bag and not on other customers or on the floor.
I think you told me this story before. I don't know if you can talk about it, but I think you said it was when you were interning at the hospital and someone was trying to take a leak and you had to hold their dick or something.
No, that wasn't. That was when I was doing an internship in a nursing home because I was thinking of becoming a nurse, and one of the patients had asked me to hold their weenie so they could urinate.
So I guess that turned you off on being a nurse, huh?
Yeah, I decided it wasn't the most exciting.
If you don't want to hold people's dicks, don't become a nurse.
That's right. unless you want to be a what do you call it, urologist? I guess you have to hold their wiener.
Yeah, so shout out to all the nurses out there. You do a great job. But let's move on to the next question. So, like, with all the pharmaceutical drugs out there, how do you memorize them all?
Repetition, and you learn different classes of medications at a time, so you can uh, keep it organized in your brain.
So, what's your opinion about people who do not believe in pharmaceutical drugs?
Well, I think there is a need for certain kinds of therapies, especially hypertension, things that require a stable treatment to keep patients in a better state of for their heart condition, or there are other things like vaccines that can prevent a serious medical condition in the long run. So I believe in most cases medication is necessary and can be utilized for a healthy individual.
So, I'm going to dive into a conspiracy theory that I've heard at one of my workplaces before. They said the medical world is secretly hiding the treatment of cancer in a vault because they want people to keep paying for chemotherapy and other drugs to get rid of cancer. What's your opinion on that?
Well, I think that cancer is an abnormality of your your body cells. So the problem lies in treatment, of certain types of cells that are in the body. So it's really very difficult to pinpoint that kind of therapy. So I don't think that there's a cure-all, secret treatment that's hidden or not being given to the public.
Okay, so what's your opinion on the state of the world and how all these pharmaceutical companies are making big bucks off of the COVID vaccine?
Well, I think one of the problems with the COVID uh, 19 or variants is that there's been so many mutations of the actual virus. So it's very difficult to, again, pinpoint an exact therapy or regimen. And then another problem is that many of the people that public in general have a problem in terms of each person reacts differently. So it's very difficult to get an actual regimen. But it seems like certain protocols that they've done in the hospitals on an emergency basis has definitely uh, helped many people, and it's important to be careful and more understanding rather than thinking that there's no COVID 19. You should take precautions by wearing masks in public and also being more diligent and not uh, spreading the disease by being a victim or going into crowds unnecessarily to cause exposure or having yourself being exposed.
So, for people aspiring to be a pharmacist, what's some tips that you can give them to become a pharmacist?
Well, you definitely have to have a good ability to communicate, have an understanding of there's medicine, and traditional medicine usually requires the doctors uh, prescribing medication. So like pharmacist has to have an understanding of the line uh, of professionalism, communicating with doctors and nurses and other professionals and also the public. So there has to be a love for you know taking care of people, and I believe that the pharmacist definitely has a key role in treating patients and people that get sick.
So, I know you worked in mail order pharmacy. Can you explain exactly what that is?
Well, usually in mail order, there are insurance companies that and health organizations that have their customers or patients that get medications at a more affordable price. So I guess with the mail order, they provide the medications for the different organizations at a discounted price. So it's almost like a wholesale provider of medications.
So you're pretty much helping people get their medications for cheaper.
That's how they manage the cost of medications, and they provide the medications at a more affordable price.
And how many years did you work in mail order pharmacy?
Oh, about 18 years.
So you would say you had a lot of experience with mail order.
Oh yes, it's some very competitive, and I think it's probably the way most um, customers and patients are getting medication these days.
So explain to me how you advanced your career from being doing mail order pharmacy.
Well, usually there's not too much advancement. You work with other pharmacists trying to get the medications to the customer in a um, the most expedient way. So there's not really that much advancement in this type of industry.
So do you think mail order pharmacy is a lucrative career?
It's pretty consistent. May not be that lucrative, but if you work there long enough, I guess you can enjoy the benefits.
Would you say your job was enjoyable most of the time?
No, it's pretty stressful, and you have to meet certain uh, meet certain deadlines and get the medications out the doors as soon as possible.
So would you have gone into a different field of pharmacy if you had to do it all over again?
Uh, Not necessarily. It's very difficult these days. Pharmacists have a lot of responsibility in community with vaccinations and being uh, exposed to other customers and patients. So there's a lot of pressure in dealing with the public.
So you think nowadays pharmacists have a lot more duties than they did when you were working?
I think so. There's added responsibilities of vaccination and also in treatment. I think the pharmacists have to do a lot of extra duties to make sure the patients are getting their medications.
Do you think pharmacists get paid enough for what they do nowadays?
Well, I think there's so many pharmacists that they're actually making less money, but I think that they deserve as much, the amount of money that they're getting, because they have to be 100% accurate.
So are companies shopping around for pharmacists to see whoever takes the lowest price, or how's that work?
Well, I think it's a law of supply and demand now, because the more pharmacists there are, especially new ones, they need to get a job, and so many of the companies can get the fresh graduates that are just out of school and are willing to work at a lower pay scale.
So in pharmacy, what do you think you could expect your salary to be when you graduate from college?
I believe it's close to high 80,000 to over 100,000, but I think that it's not quite as high as it used to be. But if you specialize in certain specialties in hospital pharmacy, you probably have a chance to get a higher salary. But it usually requires a residency, maybe a year working for a particular hospital at graduate salary, and then you get have an eligibility of getting higher salaries.
So what about benefits as a pharmacist? Do you get good benefits?
Well, I think if you work for hospital pharmacy, and in general, like for companies, they have very good benefits.
Okay, talking about specializations, I know you went to Purdue to study nuclear pharmacy. Can you go about your experience at Purdue?
Well, in Purdue, they usually require you to do certain didactic and studies in nuclear pharmacy. So this is like a prerequisite to doing your 200 hours of actual nuclear pharmacy in a nuclear pharmacy, whether it's hospital or in a nuclear pharmacy such as Cardinal Health. They're there are some companies that are uh, that that do dispense medicine for nuclear doses that are also technetium based, and also there are some independent pharmacies. So I took a course at Purdue University to get the didactic hours before the 200 hours that I did at a independent nuclear pharmacy.
Can you explain to listeners exactly what didactic means?
Well, that's usually where you learn uh, what a nuclear pharmacist does and how the proper techniques of labeling isotopes using uh, different like technetium products that are available. So there's products that are labeled for lung scans, kidney functions, also like liver functions, and also like thyroid functions. That's usually for radioactive iodine. So a pharmacist will learn different techniques of how they draw doses in a safe manner, protecting themselves from radiation. So in Purdue, they give you give you the basis or the basic techniques, and then you take those techniques to the nuclear pharmacy where you practice them so that the patients can get the medication. So it's a combination of uh, radioactive education, learning how to mix radioactive isotopes and to dispense them in the proper manner to the I guess hospitals and clinics, which take the safely uh, dispensed medications to inject them into the patients for the imaging in the hospital.
So, what would you say was the coolest part of being a nuclear pharmacist?
Well, I think it's you're dealing with helping uh, patients and and people to diagnose some of their medical problems. So you're actually doing some contributing to helping people uh, find out some serious problems that they may not have been able to get treated without a nuclear medication. If they don't get an image of their lungs in a serious situation, like a emboli that's blocking one of their lodged in their lungs, that this was a very like a life saving situation. So a lot of your stress tests utilize nuclear medications where they actually can image the heart with a stress test. Usually they use thallium, but in the old days, but now they can actually use a technetium-based product that can show how hard your heart is working in the resting and the stress phase. So there's a lot of things that the nuclear pharmacy can really uh, help to diagnose different problems in the body.
So, you say nuclear pharmacists save lives then?
That's yeah, indirectly they do.
So, they're like the behind the scenes wizards.
Yes, it's kind of uh, a pretty rewarding career in that sense. The only negative is that they have to work early hours because the medications have a short half life. So generally, the uh, medication is made up early in the morning so that it can be sent to the hospitals for early morning injections into the patient.
Can you explain what half life is?
Well, half life is the amount of time that it takes for the medication to decay. So in radiation, there's a certain T half life that a radioisotope decays down. So basically, it has a, oops, basically, I had to, uh, basically, this is what the basis of the nuclear pharmacy is, that they're able to uh, utilize uh, the radioactivity that is given off by a certain isotope that gives an image. So, in the sense of technetium, the half life is usually calculated so that when a patient gets a certain medication in the or injection, that there's a certain amount of activity left, and that the imaging machine picks up a certain amount of radiation given off by the particular technetium product wherever it's imaged in the body.
So when the medication decays, does that mean it's not usable anymore?
Yes, it actually would decay down to zero activity in a matter of a couple hours. So that's why time, the time is critical in terms of when the medication is given to the customer or the patient.
So I was wondering if you know how they discovered that these uh, radiation medicines worked. Was it like through tests on rats, or how'd that work?
Well, I think it started out with Madame Curie, where she discovered the X-ray, but the problem was that they used very strong, like plutonium or uranium, which is very extremely toxic and cause cancer and actually death because of the toxicity. So that was the original usage of X-rays in terms of like radioactivity. But then they discovered technesium. I believe that they probably utilized it in laboratory animals and then used it with human beings. But they found that technetium has very minimal uh, radioactivity, that it's not almost like uh, not really cancer causing or toxic to the body. But iodine can be very toxic and has to be handled very carefully. So that's one of the uh, problems with nuclear pharmacy. We're not really problems, but you have to be very careful how you handle iodine because it can be breathed in and can cause some serious cardiac or heart side effects.
So what exactly is technetium? Because I know that's a term or like a word that's used a lot in nuclear pharmacy.
A technetium is a byproduct of molybdenum, and there's certain kind of generator where you use a dilute or like a dilution of saline, which can produce the technetium. So technetium has to be in a certain purity, so it has to be done only certain times of the day with a new generator. So you make sure you get very pure technetium. So technetium is basically a radioactive substance, but it has a fairly short half-life, but with very minimum, I guess, certain radioactivity that's not harmful for the body.
So is it true that at nuclear pharmacies there's a lot of security?
Well, I think that you have to be careful, obviously, because you need. It's not as if the radiation is like plutonium or uranium, where you can cause a public and national security breach. But it's true that it needs to be handled carefully without causing spilling, or has to be handled where the patients have to be to get the medication done in a sterile environment, has to be mixed up. So it's not really as you would think it as being like a security problem, like uranium or plutonium or a nuclear disaster. It's not really something like that.
So it's not gonna explode like you see in the
No,
movies
no,
and stuff.
that's a fictional, not
That's a Hollywood, right?
Hollywood scenario. Yeah.
Okay, so I think we're gonna wrap up today's episode of the podcast here, talking to my dad, who was pharmacist turned nuclear pharmacist. So, is there anything you want to tell the listeners before we wrap it up?
Be nice to your pharmacist. He's trying to help you.
Don't be a Karen.
What's a Karen?
Karen's like those women that like disrespectful all the time.
Oh, I
Like
see.
that's the new generation for the memes, I guess.
You mean a hoe? Just kidding.
No, not a hoe. No, not a hoe. But
Okay.
yeah, today this is the first episode of the careers of my peers, and this is my dad. You can wave. Hello.
And there's Zumba.
Oh,
Dog.
there's my dog. Oh,
Oh,
you
see
can
her
see her.
waving?
You can see her paw.
You see her waving? There we
Yeah,
go.
you can see her
Oh,
paw.
okay.
So yeah, I guess that's everything you have to say.
Yes.
We're
Thank you
ending
very
it here.
much.
Anything you want to shout out before we finish off?
Hello to all the J Nabe fans. Listen to his music. He's a G.
Yes, I am a G, and we will end it here. Bye bye.
Bye bye.